In this video, we are going to talk about two aspects of colonoscopy. One would be the sedation to use, and the other one would be a difficult colonoscopy. So for sedation, I recommend that you use Versed or midazolam for sedation and fentanyl for associated analgesia. I don't recommend using Propofol, as it may require use of anesthesiologist and or airway, and it has its own side effects and needs monitoring. So for midazolam, the dose is 0.02 to 0.1 milligram per kilogram. It's given IV, and if you need further more dosage, you can redose it after every 3 to 5 minutes. It kicks in about 1 to 2 minutes and it lasts for 30 to 60 minutes, so you'll be good to go for the whole procedure. In terms of fentanyl, the dose is 1 to 2 microgram per kilogram, and you can repeat it after every 1 to 2 minutes. It takes 1 to 2 minutes to kick in, and the duration of its effect is 30 to 60 minutes, so you are good to go for the whole procedure. Now let's suppose you're in the colonoscopy suite. You've started the colonoscopy and you're in the sigmoid colon and you just cannot advance. Now in this case, what you should do is you should withdraw the scope clockwise. If that doesn't work, then withdraw it counterclockwise if the previous attempts have not worked. Now if you're withdrawing, the next step can be you place pressure on the abdomen where the sigmoid colon would be, and then withdraw it again. Then you can also place the patient in supine position, or you can try the right lateral position to see if the scope would advance. And while you're trying to advance it out, you can also try to straighten it and see if that works. So changing the position, pressure on the abdomen, clockwise and counterclockwise movements as you withdraw can help. Now, if all of this doesn't help, then you can abort the procedure. Either you can ask your senior partner to do it, or since the patient already had a prep, the second step would be either you can do a barium enema or a 3D colonography. Now, the CT colonography. Now, the downside to the CT 3D colonography is, of course, if you find something that may need a biopsy. But on the other hand, the advantage in this regard would be that the patient has already had a prep, so you can get a good study. Thank you.